Hi, everybody. My name is Michael, and this is Joe. We're going to talk to you today about penile implant procedures, pre-op and post-op. Joe, go ahead and tell us about your experience.
Well, I got here about 30 minutes before the actual procedure was supposed to be scheduled. I did a little bit of paperwork, and they took me back to the room. Spent a little bit of time with the nurse. They did the typical procedure, checking your vitals and temperature and things like that. And then a couple minutes later, the anesthesiologist came back, spent probably 5-10 minutes with me and talked to me, explained the procedure, what was going to happen and how she was going to do the anesthesia. And then I got to talk to Dr. Hackey for about 5 minutes with my wife, and he said, "I'll see you on the other side."
All right. Now, let me just interject here for just a minute. Now, you may be asked to come early at any time. So 30 minutes is about normal, but most people just plan to arrive early if possible. Go ahead, tell us a little bit more.
Well, after the procedure, I was in recovery. I brought my wife back, or she was waiting on me, I guess. I had a catheter in. I guess that sometimes is and sometimes isn't. In my case,
yes.
I had the catheter in, and I also had a drain, scrotal drain, I guess they call it. And they explained what to expect with that, and so I kept track of my in and out fluid levels. They told me how to drain everything when it was time, and explained to my wife as well. And so we left, I think around 2 or 3 o'clock in the afternoon, and the next day I came back. They removed the catheter and checked everything, rewrapped what was necessary. And then I came back the following day, and they took out the scrotal drain. And then I saw the doctor, I guess it was 2 weeks later, and Dr. Hackey checked me. And everything's moving along pretty good.
That's good to hear, good to know. Now, just so everybody knows, not everybody necessarily goes home with a catheter or even gets the catheter during surgery. It just depends on the situation at that time. And the same with the drain. You may have one, you may go home with one, you may not. It just depends on the circumstance of that particular moment during your surgery and after your surgery.